All right, we've got Dominick with,
Dr. Barbara.
yeah, and what?
Oh, back to black seal coating and
so-
striping.
And this is Dr. Barbara with Third Opinion MD. So we're gonna see Dominick about some pain. I saw you standing at the,
Yeah.
you weren't even sitting with us. What was going on?
Lower back.
Okay.
Lower back, right side.
Where can you
Yep.
stand up for me and let you see?
All right in here.
Come, step back here. There you go. So what part? Low?
Yeah, low back. I mean, it's basically from like mid back through like the upper buttocks.
Does it hurt when you bend or straighten?
It hurts when I bend.
Okay, so bending
Yeah, bending
forward.
over,
Do you
like getting out of bed.
Does it radiate down at all?
No,
Or
it's
move
just
down the
like
leg?
right in there. Yeah,
Okay.
yeah.
Let's have you have a seat.
Yep.
And we're not going to work on your back, actually. We're going to be working on your hand.
Okay, what's,
So, yeah,
Okay.
so the deal is if you make an animal on all fours like this.
okay,
And this is the head, neck, upper back, arms, legs, back of your body, and then front of the body.
okay.
Okay? So we're going to look for the back here. So are you in a comfortable position or
Yeah,
do you want to?
I'll rotate a little bit.
Yeah. You okay sitting right
Yeah.
now? What's your level of pain right now when you were trying to?
When I was standing up, I mean,
Yeah.
you know, on a realistic pain level, probably like a 6,
Okay.
6, 7.
6 to 7 out of
Yeah.
10? You want to call it a 7 right now?
Sure, yeah.
Okay, and that's
yeah.
when you've bent
When
forward?
I'm bending over, yep.
Okay, so what I'm going to do is I'm going to be putting some pellets. These are not needles.
Okay.
You ever had acupuncture?
No.
Oh, this is perfect.
Yeah, never
okay,
had it.
Okay. This works exactly like acupuncture, but without the needles.
Okay.
So we're looking for, go ahead and relax your hand. We're going to look for somewhere in the low back, because it's not in your thoracic area, or what you call the rib cage.
Yeah.
Okay. So I'm going to look for, how far low does it go?
I mean, it's like, just, maybe like 3 or 4 inches down past that waistline.
Yeah.
Yeah.
So like L4, L5?
Yeah.
I'm going to draw on you, is that all right?
Yeah.
Okay. So I'm drawing your sacrum. So this is your sacrum right here. And that sacrum is that bone that's below all the low back
Okay.
bones. So you've got lumbar, then thoracic. So lumbar is where you're talking about the pain. And we're going to find, just with a broad sweep with a tool, you can probably even get a punch tool, but these are special tools that work with this technique that's called Korean hand therapy, or KHT. And
Okay.
it was developed because the guy was like trying to find a way that people could take care of themselves. So I can help you with these things, but I can also teach you. And we're looking for like first areas where it's kind of tender, or medical term is crunchies.
Okay.
Okay.
Crunchy right there.
You feel it, right?
Yeah, oh yeah, right there.
So,
Oh yeah.
Okay. More on the right than the left. You
Yes.
Notice how it's
Oh, yeah.
more tender
Way more on the right.
And that's your right side,
Yep.
and that's your left side.
Absolutely.
Okay. Okay, so what I'm going to do is first find the spots, and we need to find a spot where, I don't want to call it pain, but the loudest kid in the room, the strongest point.
Okay.
The stronger the point, and this is literally directing the brain to direct the body back.
Okay.
So if we find the point that makes you go like,
Cringe,
or
yeah.
cringe or grimace or sweat or tear up, that's the point that we want, because within seconds you can get a relief of your pain.
That's crazy.
It's totally crazy, and it's like beyond your belief. So some people will react in a weird way, like they'll say, "Oh, well, it must be such and such."
Yeah, right.
It can't be real because this is my hand.
Yeah.
But this is another system, and so I've studied a few different systems, and if we combine them, it can really make people's lives a lot better.
Perfect. I mean,
Okay.
that's what I need.
All right, so let's find the crunchies. And it could even be ooh, that's
It's a crunch.
That's a crunch.
There's
That's
a crunch there.
crunch. Okay, so first we're going to go broader and then go like points, more pointy. So tell me where it's
Right there.
right there. Okay,
Yeah.
let's go even more specific.
Oh yeah.
Where is
You're
it?
right there.
Where is it the
Right there.
worst? I'm going to keep looking around.
Okay.
Which one is it?
Right there. That's a good one.
Or is it this one? You see his
Yeah,
face?
yeah,
Okay.
yeah.
Yeah.
Yep.
Is it that one?
Yep.
Okay, so I'm gonna push on this until that strong feeling
Mm-hmm.
goes down like a dial on a volume.
I mean, it's already going down.
It's already going down.
Yeah.
Okay, let's make sure we didn't get another.
Oh, yeah, yeah,
there
yeah,
it is.
yeah.
Okay, let's keep going till that dial goes down. It doesn't have to go away.
It's definitely, I mean, it's
It's calming down
Yeah.
already? Okay. So let's just first have a look. I'm going to put the pellet on. Is that the spot?
Yep, that's the
Okay.
spot.
Go ahead and stand up
Yep.
and just tell me
sorry.
what you can do in terms of like pain.
I mean, it's better. I mean, I still feel a little bit, but
That's
I mean,
okay.
it's
So what has it gone down to right now?
probably like a 5.
Okay, look, come sit. So we went from a 7 to a 5, but that's not enough. We want to take that further. So we chase the mouse.
Okay.
We're going to chase the pain, okay? So I'm going to take this one off for now and mark it so that we can, is that the point still, or is it already
Yep.
calmed down?
No, that's the point.
Okay. Okay. Because I think there's more.
Oh, yeah.
Oh, yeah, there's more here.
yeah.
Now, where in the back is it now?
Where's it hurting now?
Yeah.
I mean,
Is
still
it
that same.
same
It's,
spot?
yeah.
Has it shrunk, or is it about
It's gotten
the
a
same?
little bit smaller. It's more centralized, like right
Right there?
Right
Okay.
there,
Okay,
yeah.
let's go to now this side. Okay. That. And let's put a point on there. And I'm going to just readjust this so I can put more than one point on here. Is that it right there?
Mm-hmm.
Okay, go ahead and stand up. And let's have you,
You want me to bend over?
yeah. Look at that, the range of motion got a little bit better.
Yep.
Yeah.
Whew.
Okay, what's that gone down to?
Probably about 4.
4? Okay, let's keep going. I'm not satisfied with 4. Are you?
No, let's shoot for what? We're shooting for like a 2?
Let's shoot for
A 1? 0?
why not? We could. Yeah.
That doesn't hurt that bad.
No, it's getting better.
Yeah.
So each successive pellet that I put on, it actually will calm down the
down.
next one.
Okay.
And it's faster response.
Okay.
So it's the first one's always the most difficult one.
Right there.
Right there?
Yep. Yeah.
Or is it this
Right
one?
there. Right there.
Are you sure it's
Yeah,
not that one?
oh,
I
yeah.
think we found one.
Yeah,
Okay.
that- that's it.
When that starts to calm down,
Much better.
it's already, see how it's
Yeah.
faster now than the one before? So we're going to mark that. Was it this one?
Yep. Oh, yep, yep.
Let's see. And we'll put a pellet on there. These pellets are not,
And what are
that
the? Yep.
yeah, okay, go ahead and stand up.
So what are the pellets doing?
They're actually transmitting a bioelectric current. So they're aluminum silver pellets that are conductive, right?
Oh, okay.
So anytime the body, how's your back feeling?
A little bit better.
little
I
bit
mean, it's still
better?
about probably a 3 maybe.
Oh, 3, okay. Slow but steady progress, right? But it's not that slow, right? Because what has it been, less than 10 minutes?
Yeah.
And we've been working on this. So let's keep finding, where's the pain now? If you were to isolate it, go ahead.
I mean,
Yeah.
so when I bend over,
Yeah,
it's like literally right there.
right there.
Yep.
Okay, so now, okay, I have an idea. So it's wrapping around, or
Yep.
is it starting
It's
here?
It's like starting like almost kind of at the spine and then wrapping around the waist.
Wrapping around the
Yep.
waist. Okay, have a seat.
And where'd you learn this?
I learned this over 30 years ago.
Okay.
My mom sent me a care package in college. She was a doctor too, and she studied this. And she said, "Hey, you should take care of yourself." And she sent me these pellets and maps. And then I went on to study it, and now I'm one of the leading teachers in the nation.
Nice.
Actually, I took over the top instructor.
Nice.
He passed it on to me. So
Oh,
that's
yeah.
really, really crunchy and sore there, huh?
Yep.
Okay,
Very sore.
okay.
Oh, yeah.
There.
Yep. Yep.
There.
Yep.
Okay. You see what's happening there? The grimacing.
Mm-hmm.
Yeah. So we want that. We want that really the strongest point. That's going to get us more. It's more money.
Right.
You know.
It's starting to calm down a little bit now.
Okay. We'll put a pellet to continue the process, so we don't have to keep doing that. That's why we put the pellet on there.
Okay.
And you can keep that pellet on for minimum 4 to 5 hours, and then, is that it?
Yeah,
That's it? Okay.
that's it.
Okay, go
Yeah.
ahead and stand up. Especially like things like sciatica. So range of motion is already getting a little bit better.
Yeah.
How's that feeling?
Yeah, I mean, it's still, I mean, it hurts when I get to that low point.
But did it hurt?
Not getting to that point, no. I mean, like when I stood up over there, I was like,
Were you in
when I was
pain?
walking to the bathroom, I was like
Yeah, so now,
flexing my core as hard as I
so
could.
now walk around, do you have to
Oh,
flex
yeah.
your core?
Yeah, no. Literally, when I got up, I was like,
So
I felt
now,
like an old man.
So now you can walk around
Yeah.
with pain or without any?
I mean, with a little bit of pain, but nothing near,
How much pain do you have with just walking around now?
I'd say compared to what I had before.
Yeah.
When I got up originally, it was probably like an 8, 7, 8. And I'm probably like a 2 to 3 now.
Isn't that amazing?
So,
That's pretty cool. Huh?
yeah.
Yeah. But see, I'm not satisfied.
She's not done yet.
No, I just want people to get better. You got time. I got the pellets, man. Okay,
Right there.
right there.
Yeah, right
Okay.
there.
Okay. Breathe. Don't forget to breathe. Good. And then that dials down. You know, if I'm applying pressure to a point and it's not a point that needs to be addressed, it won't light up and be sensitive.
Right. That's better.
Okay. Put a pellet on there. And these pellets don't pierce the skin. Is that it?
Yeah.
Oh, yeah.
Yeah,
There
that's the
you
one.
go. Okay. So you can press on these too. I'm going to put some tape on it, but go ahead and stand up and let's see. Walk around a little bit.
Oh yeah. I mean, it was. Yeah, I literally when I was walking to the bathroom earlier, it was a struggle.
Yeah. And now?
Now it's fine. I mean, not fine, but it's night and day different.
Like, what's your number?
I'd say I'm still probably at a 2.
It's pretty good though.
Yeah. No,
You know?
I mean compared to what I was, absolutely.
And it still might continue to do a little bit better.
Mm-hmm.
Do you remember any injury at all from this?
No, I mean I've never. I mean so this has been background. This has been going on. It seems like it's recurring like every 3 months. Like I'll go 3 months and everything's fine, and then all of a sudden out of nowhere, and it's like and I haven't done anything. My back will just start hurting. It started this about a week ago.
Yeah.
And it's progressively gotten a little bit worse to like this morning when I got out of bed. It was.
Where does it start when it starts?
It's all of a sudden I'll start to feel that low grade pain, like a 1 or 2 in the same spot in my back, and then it just gets progressively worse. And then I have a 2-year-old, so
Who's getting heavier?
yes, and
Yes.
still wants to be picked up and
That's
still
right.
wants to be carried around every once in a while, and so I think that's kind of accelerating it or making it worse when I start to feel it, obviously. So
Definitely. Are you
and then
doing-
just the nature of my job, I'm constantly on my feet all day long, and so and obviously taking Tylenol and Advil.
Yeah, and so
And
this,
it didn't even touch it yesterday.
Tylenol and Advil won't touch it, but
Yeah.
look at what these pellets did for him today.
Yeah.
They brought it down from an 8 to a 2.
Yep.
And when we always ask for 0, that's not what we're always asking for. Sometimes we're just asking for a break.
Yes, it's just maintenance so I can go to work and
'Cause this is more
perform what I
chronic-
need to do.
This is a more chronic problem that's going to need probably some additional things and maybe repetition. But yeah, I would recommend, working on getting this treated, not just at this level, but also at what's called more of the root level, where I would diagnose and sort of see like where are you more weak in certain channels and excess in other channels.
Okay.
Do you know what I mean by that with acupuncture?
No, I've never done acupuncture, but I mean, I'm terrible at making doctor's appointments, and I'm terrible at like taking care of my body because that's just I'm
Join the
just
club.
the average male who just like, I'll be fine, I'll be okay,
Yeah.
I'll get through it. But as I'm getting older, it's like I don't want to be 55 when my daughter's 14 and not being able to run around and do and play and
You don't want to wait.
no,
You don't want to wait.
yeah,
And it is true, like guys are less likely to go to the doctor because one, it's a sign of, which is silly. Weakness.
Right.
I know.
I mean, is it really?
But
yeah.
you know what's weaker is not taking care of yourself.
Right. Yeah. I mean, in the long run, it's going to
Yeah.
have more effects, negative effects than taking care of it.
You know how cool it is for you to be like at the top of your game and to do things ahead of it,
Right.
and that to me is strength.
Yeah,
So,
absolutely.
yeah.
My fiance's constantly on me about it.
Yeah.
Because she's the,
No,
she's the habitual. She'll
go.
anything that's wrong. She'll make a phone call and go.
Yeah, but you see how if you're not internally motivated to do it, you're not going to go and get it done.
Yeah.
And that's one of the reasons why I started this YouTube video literally yesterday. I started a channel.
Okay.
And so I don't know if you want to check it out.
I will. Yeah.
But I'm actually walking the walk and practicing what I preach. So
Okay.
I do this stuff. I do other stuff that's called Qigong that's good for sort of helping to restore your health. And it's like stretching, moving, breathing and mindfulness. And they all seem kind of strange because in Western medicine, we're only looking at like nerves and blood vessels and bones. But in another system, they like kind of looked at stuff and wrote it down. So they observed stuff for a long time and at the behavior of things, like how things are, but not what they look like. So they noticed that things would change, and that's how they drew out these channels. And that's why they started to talk about this concept of qi, which is, if qi is moving, like think of a river, if it's moving through all your channels and there's no blockages, you're in good health, emotionally, physically,
mentally,
and mentally and spiritually. You feel good.
Yeah.
You feel like a kid.
Yeah.
And if you don't, you feel older. Because you could not have any problems right now, or you might not feel well and you go to the doctor and they don't see anything on the blood tests or the x-ray or the MRI. But in Chinese medicine, we can see before you see.
Okay.
And we can agree with how you feel.
Yeah.
So that's why both of East and West work well together, and that's what I do.
Awesome.
Yeah.
Hey, Dr. Barbara.
Yeah.
She helped me out.
All right. Thank you so much.
Thank you.